Hello and welcome back. This is Dr. Namnara and this video is going to be dedicated to the exam going batch of diploma, the theory exam going batch. First, I am really sorry that it took so long to get me this video out. So without further delay, let's get into it. Your theory exam is going to be of 3 papers back to back, like today, tomorrow and day after. There's not going to be any day break between it. Mostly it happens during the later session, like the afternoon session will start at around 2 p.m. and end by 5 p.m. My specialty being Obgyn, I will talk about Obgyn a little more, but almost all the subjects are going to look like the same. So paper 1 is going to consist of basic sciences and recent advances. Paper 2 is going to be purely obstetrics. Paper 3 is about to be gynecology. So in paper 1 you have to study anatomy, embryology and the basic of obstetrics and gynecology both. Paper 2 obs, just obs. Paper 3 gynecology. Now one important thing that I cannot stress enough on, do not think that the paper is going to be the evening session, so you'll be getting the morning hours to study and you can leave few topics till the day of exam. No, you can't. Before the exam itself begins, you have to be prepared with the whole subject, because those few hours you'll be getting just before the exam, you will be just able to revise it, hardly go through it. So don't leave any topic for the last moment. Finish everything before the exam itself. Now, few exam tips for the theory exam. 1. Get to know your exam center day before, or days before in advance. How long will it take you to get there? What is going to be the best mode of transport? Or if you want to be there, get a nearby hotel or something. Get to know this in advance. You will know your center or get your admit card around a week before the exam date, so you will have enough time to know that. Second thing, about dressing up. See, there will be mention on the admit card that you can't wear watches, jewelry and big button stuff. That is there, but considering the weather, dress up a bit casually. And most importantly, what I will tell you is avoid wearing shoes, okay? Because when you will be going through the frisking, they will ask you to take your shoes and socks off and then put it back. So it's gonna be quite time consuming and frustrating as well. So that is one advice I would like to give you. Next, pen. Take good quality 2 to 3 pen for you. You'll be allowed to carry it in a transparent pouch. Now there are people who prefer different color pen to highlight and to underline. I would advise you against it, because one thing, you will not be getting that much time. Second thing, that you might want to make your paper appear good by colors, but that might actually backfire for you. The consultant probably might think that you have a lot of time, so don't do that. Use one color pen, underline, or use capital and small letters. That's it. Second, to draw a lot of flow charts and diagrams, use pen or pencil, not more than that. Okay. Next, draw as many as flowcharts instead of writing long paragraphs, because you're gonna have 5 pages fixed for one answer, and most of the questions has 1 to 3 parts. So 5 pages are not enough for a lot of people. So just draw a flowchart, and if that covers everything, you don't need to write it. That is more than enough. Your paper is going to be lengthy. For the first batch 2021 batch, it was quite lengthy, and then a lot of people were not able to cover the paper. So my advice will be, read your paper properly and understand it well. Know the question. If it is asked, suppose in gynae, it is like a nullipara with fibroid or adenomyosis, or a woman who has completed her family with AUBP or AUBL. These are two different scenarios, okay? So read the question properly, see what is asked and answer that much only. Don't do like, if, but, no. There's mentioned like this with this management. So don't do if and buts and put your own brain into it. Answer what is asked. One, you do not have much time. Two, they don't want to know how much you know extra. They just want to know what they have asked. Now coming to the second most commonly asked question to me from you guys is where to study it from or what to study. So whatever you are following as of now, whatever textbook or notes or whatever, it's good. Just revise that. See, if you have worked in the situation in the hospitals, that is what they're going to ask. You don't need to mug up the theory. You have seen patients, you have managed patients. That covers like 90% of your paper. 10% is a theoretical part, like HPV vaccine is asked, or some recent advancement is asked, some laparoscopic procedure sort of thing is asked, which doesn't actually happen in your hospital. But 90% of it is from the patients you are seeing every day, and you only need 50% marks to pass. And passing is the only thing that matters, okay? Nobody cares whether you're getting like 100% marks or a gold medal. Nobody really cares about it. So what I followed is JB Sharma. I have read Williams and Barrack and Novak and everything, but for exam revision part, I stick to JB Sharma flowcharts, and I did score very good marks, so you can take it from me. JB Sharma is good. Stop doubting JB Sharma. JB Sharma is good. For gynae part, I stick to Barrack Novak and flowcharts of JB Sharma. Onco part I did not read from JB Sharma, but I think that is okay too. So now just 10-15 days are left for exam. So now what you're going to do, you're going to go through all the flowcharts of JB Sharma or any book you are following. You're going to go through the flowcharts. Second thing, what you're going to go through is the management part of every disease. For every paper, there is going to be management for 2 to 3 diseases. Okay, so you're going to go through the management part. Next important thing is pathophysio. Pathophysiology of a certain disease, you have to know that. Next part is the ETO. So it is sorted: management, pathophysiology, and a journal and flowchart. That's the 3 things you're gonna see. The onco part, yes, you have to know the classification, the FIGO classification or some other classification is there. ASRM and H3, it is important, but not that much. FIGO will do. Okay. In basic sciences and recent advancement, basic sciences, you have to know the blood supply and the lymphatic drainage of particular organs, also the path of ureter. Okay, that is very important. The path of ureter, the surgical importance of it, where you can injure it, how you're going to manage it intra-op, post-op, that is very important. Other thing is blood supply. That perfectly drawn diagram of internal iliac, that is extremely important. Gynec, obs, doesn't matter what. Internal iliac artery is the most important artery for gynec people, obs and gynae. So you have to know the diagrams, where it is draining, what are the anastomosis, where you're gonna, in particular surgery if you mess up, where you're gonna ligate it, or where anastomosis is needed. So that part, you have to know that. For recent advances, there are not going to be much of recent advances. See, now in India, HPV is becoming a huge thing. HPV vaccine started back in 2006 or 2007, but in India it's hyped up right now. So for India part, HPV is now the recent advances. Second thing is the fertility preserving surgeries or some recent advancements in carcinoma part. That is important. Okay, there are a few things, but if you somehow you don't have time, if you want to skip, you can skip the recent advancement part. Okay, basic sciences will cover enough, or you have been attending the webinars and other things, so you would know it enough. So if you want to skip, you can skip recent advances. Don't go buying new books, stud or other books for recent advances at this point. Don't. Basic sciences is good enough. Whatever book you have is good enough. Okay, so if you have any other question, do ping me up and I would try to respond as soon as possible. All I want to say is all the best. Don't stress about it. you're going to clear your exam very easily if you have worked in your setting. If you have seen patients, if you could manage patients, you're going to easily clear your exam. The NBE exams, diploma exams are not something, you know, super difficult or hyped up like that. No, you will be able to clear it. So go to exam, write it with a cool, clear mind, and write it in a clear handwriting that your consultant is easily able to understand. So all the very best.